Morning, students. Today we are going to discuss MCQs in the pharmacology. MCQs plays major role to get the good marks because first paper 20 and second paper 20, total 40 marks, 40 MCQs you will get in the exam. If you do good in the all MCQs, you will get the good marks. Then administration solid dosage form of the drug in the rectum is called. They will give you different type of options, but you have to select here. Before going to give the answers in the MCQs, always think what question they are asking and what are the options they have given. In each option, there will be some relation, but one will have the correct. First, you have to know what are the terms they have given and what are their meanings. If you know that, automatically you can answer the things. In general pharmacology, it's very easy to answer the MCQs because all will have the standard definitions or meaning. If you catch the meaning, then you can answer it. Here we can see the administration of solid dosage form of drugs in the rectum is called what? Tablet, enema, suppository, and none of the above. For example, if you say tablet also has a solid form, but if that solid form, if it is given in the rectum, what is the name? Okay, that's the way you should think it. Normally students, what they will answer as a tablet, but it is a wrong. Okay, it's called as suppository. Then insulin cannot be administered by which routes? Before knowing which routes it not be given, if you know the what are the routes we can give insulin, then automatically you can answer sublingual, transdermal, and intravenous or oral. How you can think is what are the formulations is insulin available? Insulin is available as a liquid form. Then you think what are the things, what are the routes we can give? Okay, if we give in that routes, will it absorb or it will metabolize or it will excrete? What will happen if you administer in the each route? Then once you think that way, you can get the answer. Oral, why we should not give in the oral? Because it will be destroyed by gastric HCl, because insulin is made up of with proteins. Once proteins enter into the acid, automatically they will be destroyed. Then 100% bioavailability can seen in this route, intravenous, because drug directly enter into the systemic circulation. That's why there is no metabolism. Then the drug directly administered in the joint space is called. Then here simple. If you know the meanings of each route, then you can easily answer. It's called intra-articular. Then where we will use this is the, it's in the rheumatoid arthritis. Then kept beneath the lower eyelid, what do you call that? It's called occusat. Then what is the example? Pilocarpine. Which of the following drugs can be absorbed faster? Here simple thing is, what type of drugs will absorb faster? One is either solid, liquid, gel, or ionized, unionized, or water soluble, lipid soluble. These are the categories. In that categories, which are all can be absorbed faster? Now you can think what can be absorbed faster. Can you guess, anyone? Anyone? Yeah. Here it says unionized drug. I will tell you simple thing you remember. Unionized lipid soluble drugs will absorb faster than anything. Unionized drugs and lipid soluble. Okay. Then which drugs will absorb faster from the stomach? Acidic, basic, and for this you should know once drug enter into the which environment, what will happen to drug. Always you remember unionized drug will absorb. Then ionized state will change according to the surrounding pH. Yeah, acidic drug. This formula you should remember. Okay, acidic drug enter into the acidic medium, it become unionized and it will absorb. If acidic drug enter into the basic media, it become ionized. Then it won't absorb. For basic drugs, it's the same concept. Basic drug, basic media, unionized, absorb. Basic drug, acidic medium, ionized, unabsorbed. Here, is a simple example is aspirin. Aspirin is acetylsalicylic acid. It's a nature of acid. Once you administer orally from the stomach, it will absorb faster because acidic drug, stomach have acidic environment, become unionized, it will absorb faster. Once it is entered into the intestine, intestine will have the basic pH. Acidic drug, basic pH, it become ionized. Then it won't absorb. Simple is acidic drug will absorb faster from the stomach. Basic drug will absorb faster from the intestine. Then what type of drugs undergo redistribution? Here simple thing is which drug will go and store in the body, they will undergo redistribution. Then why how what drugs will undergo store in the body? It's a simple, body is made up of with lipid, like all cells everything will have lipid. Then which drug have lipid soluble, it will go and store there, then it will redistribute. Lipid soluble drugs, this type of drugs concentrated in the tissues and released from there when plasma concentration is decreased, it's called redistribution. Then highly protein binding drugs, what are the things will happen? Like all of the above. Okay. Highly protein bound drugs, they will have long duration of action because they won't be separated. Then low volume of distribution because they will be circulating in the blood. Then undergo slow metabolism. Always remember, feed free form of drug will undergo pharmacokinetics and pharmacodynamics things. Once drugs bind to something, will not undergo anything. Then oxidation of drug is a phase 1 reaction. Here we have the phase 1 reaction: oxidation, reduction, hydrolysis, cyclization and decyclization. These five are called phase 1 reaction. Other than this, everything is called phase 2 reaction. Enzyme induction can also useful in that, where congenital non-hemolytic jaundice, it's a simple genetic disorder where bilirubin cannot be metabolized. Now, if you give the phenobarbital, it will increase the microsomal enzyme system. That stimulated microsomal enzyme system will start metabolizing the bilirubin. Okay, that's why then that baby will get the jaundice less. Then why it is not metabolized is the because they have a problem with the glucuronide conjugation. Okay, normally bilirubin will synthesize, that will undergo glucuronide conjugation and eliminate from the body. But in some babies, this glucuronide conjugation will be very slow or may not be there. That condition, if you give enzyme stimulator or enzyme inducer like phenobarbital, that will stimulate the glucuronide conjugation system, that will causes metabolism of bilirubin, then jaundice will come down. That is the logic why we are using phenobarbital in the congenital non-hemolytic jaundice. Prodrug, always you know, pro means before. Drug, that's prodrug is the inactive form of drugs. Levodopa to dopamine. Then what type of drugs excreted from the breast milk? For this already I told you, acidic and basic nature. Now if you know the what is the nature of breast milk, automatically you can guess it. Basic drugs, because breast milk is acidic. Okay, if the basic drug enter into the milk, it's become ionized and it is excreted. If acidic drug enter in, it will become unionized and again it will reabsorb from the alveoli. Then plasma T half helps. What the plasma T half is the one of the pharmacokinetic parameter. What it will tell to you? That is the to determine the duration of drug action, then to determine the frequency of drug administration, to reach the steady state concentration. All these things will be done or calculated according to the plasma T half. Now, what is plasma T half? It's a simple, how much time is required to eliminate half of the drug from its original concentration. Simple way of telling, you have given 100 milligrams, how much time is taken to eliminate 50 mg. Simple. Next, a constant fraction of the drug is body eliminated per unit time. This kinetics of elimination. We have three types of kinetics of elimination: zero order, first order, and mixed order. Zero order, at the end of the thing, the drug will become zero in the body. But in the first order, there will be off will be there, off like that. Some minute amount will be present in the body. That's called first order kinetics. But nothing will be there, everything will be eliminated. It's called zero order. Then mixed order, first drug will undergo one type of elimination, and depending upon the administration, it will undergo other. That's why it's called as a mixed order kinetics. First order kinetics, then large dose of drug is given with the aim of attaining steady state concentration rapidly is called what? What is called that? That's called loading dose. Then therapeutic drug monitoring is required for what type of drugs require TDM. Okay, that's a drug will have low therapeutic index. Okay, like lithium, digoxin, phenytoin. Then what drugs administered repeatedly at a short interval responses diminish the rapidly. Here it is simple is, if you are giving repeatedly, there will be reduce the drug effect. What do you call that concept? It's called tachyphylaxis. What drugs will show that tachyphylaxis? Adrenaline or amphetamine. Now here you can see the tolerance means, what do you say? If you increase the dose, patient will be tolerating that. It's called tolerance. Tachyphylaxis already I told. Functional tolerance is the same. Then the unwanted effect of drugs which are seen in the therapeutic doses. If you administer within the therapeutic dose, if you develop unwanted effect, what do you call that? It's called side effect. For example, atropine, dryness of mouth. Then idiosyncrasy. What is idiosyncrasy means? You will expect something, but it will produce opposite effect. Okay. Idiosyncrasy, drug-induced adverse effect, hypersensitivity reaction, drug allergy, genetically determined adverse drug reaction. What it is? Idiosyncrasy means genetically determined adverse drug reaction. That is hemolytic anemia. Normal people will not have that, but if you give primaclone or sulfonamide, succinylcholine, like primaclone and sulfonamide, if you give, they will show, some people only show the hemolytic anemia. Same way succinylcholine apnea. It's not seen in all the people, only it will be shown in the some people. Physician induced disease due to the drug therapy, what do you call? It's called heterogenic diseases. Parkinsonism, Parkinson like symptoms by treatment of metoclopramide, peptic ulcer by NACD. It is you, for some disease you are taking the medication or doctor prescribed medication to you. Because of that usage of medication, you develop some adverse effect. That is called heterogenic diseases. Then teratogenicity is well known. It is a drug if you administer pregnant woman, it will produce the fetal abnormalities. It's called as a teratogenicity. Drug administered to the mother during the pregnancy. What are the drugs? You example is the phenytoin, thalidomide, warfarin. Then toxic effect of overdose. If you give overdose, it will produce the toxicity. Warfarin leads to bleeding, aminoglycoside, nephrotoxicity. Then release of IgE antibodies causes which type of hypersensitivity? Total we have four types of hypersensitivity reaction. One, two, three is mediated by antibodies. Third one will be mediated by cells. IgE1 is a type 1. What are the things we will see? Manifestations, itching, urticaria, fever and asthma. Then zero order kinetics, already I told you, it's a dose dependent. Then all the synthetic reactions except reduction is a phase 1 reaction. Then universal antidote consists of all except there's a calcium lactate. Then drugs interact with the receptor site by forming what type of bondings? All of the bondings. Then, but if it is form ionic bonds, hydrogen bonds, or van der Waals bonds or not, they will be reversible. If it is it is bound to the covalently. This is irreversible. The drugs decrease the drug response in the presence of another drug, and it's reversible. What do you type of antagonism? Okay. It's a competitive antagonism. You should listen question. You should read question properly. Decrease the drug effect of in the presence of other drug is called antagonism. But it can be reversible when you increase the dose of agonists. That is called what type of antagonism? It's a competitive antagonism. Example: adrenaline with propranolol, morphine with naloxone. Then the combined effect of two drugs is equal to the sum of their individual effects. Here, if you give the separately drug, what how much effect you are going to see. If you give individual also, you will see the same. What do you call that effect? It's called additive effect. Additive means addition of effect. With this, these are the major really repeatedly asking MCQs. Okay, if you like my videos, please like and share, and we will see. I will give the next. I will tell you next class regarding the autonomic nervous system MCQ. Thank you. Please subscribe and share my channel. Thank you.